Hi, everybody. It's Yvonne DiVita and Dr. Larry McDaniel, and we're going to talk about cats and pet health insurance today. Some stories I've read on the Internet, a story that was in USA Today last weekend, talks about the fact that cats don't get no respect. And one of the things the article talked about was that vets have far fewer tools to treat cats than dogs. Dr. Larry, what do you have to say about that?
I think that there's a little less research done on cat diseases, that dogs, because they're more of the favorite, I guess, more of the Lassie, Rin Tin Tin mentality, they tend to get more research dollars into chronic diseases. Pain medication for cats, there are a lot of options for pain medication for dogs, and we've talked about what a big deal chronic pain is, especially in older dogs.
Right.
Well, cats, they experience chronic pain too, and they may not show it in the same way a dog does because of their stoic nature, but there are fewer chronic pain options for cats, and they were slower to develop. And I think that's just another kind of hangover from the whole mentality about the cat can take care of itself, the dog is much more dependent and needs much more interaction with a human and much more intervention. So it's and they get they visit the veterinarian fewer. I think there are something like 30% of cats in this country that never go to the vet. That number is much higher than the dog. And I think in terms of annual visits, they're slightly over one visit per year for cats, and it's almost 2.5 for dogs. So there are a lot of differences in healthcare. Another difference is the pet health insurance.
Yeah, let's talk about that in relation to this issue.
Right. Well, cats, it's the same story. The statistics are really interesting. 85% of pet health insurance policies are sold for dogs. And we've talked about this on the pet blog. I think that the cats are more stoic. People perceive that they don't get sick as often. A lot of people keep cats indoors, and they think that makes them impervious to any type of disease problem, which is untrue. But cats, it's a mistaken notion to think that they're not going to experience a serious medical problem, because cats have, a number of serious medical issues that would be very beneficial for them to have, pet health insurance.
And to start it early, when you first get your cat, perhaps as a kitten, take it to the vet, get it checked over, and get that health insurance, because it's true. I know when I was a veterinary assistant, one of the major things we treated was diabetes.
Yeah, diabetes is fairly common in cats, and people don't recognize that. One of my daughter's friends was over the other day, and she had just gotten a new kitten, and we were talking about PurinaCare pet health insurance, and she said, "Do you think I should get him insured?" And so we went on the website, and we got a quote for our little area of town, and she doesn't have a lot of money. She's a bartender, so she's not making a lot of money. And we looked at the various deductible options, and at $500 deductible, her premium for this kitten, it's about 3 months old, would have been less than $20 a month. And her comment to me was, I spend way more than that on lattes in a week.
Exactly. Exactly. We have to get our priorities straight in this country, honestly. Yes, and that is one of the surprising things, I think, about pet health insurance and PurinaCare. And people should go and at least go through the process of getting a quote. That doesn't cost anything, and I think they'll be pleasantly surprised, because having that insurance today, it's just a real worry saver, because you can then know that, like your kids, your pet is covered.
Right. I mean, Yvonne, you could get a $1,000 deductible policy for your cat and have it taken out each month, and you would barely notice. So, I mean, and for the peace of mind, suppose your cat gets some chronic disease. Suppose it gets diabetes. It needs care for the rest of its life. Then, then you're covered. Suppose it has, some bladder stones or something like that and needs surgery or any number of things. It's just a small amount of money to pay for a great deal of peace of mind. And cats do get a lot of serious diseases. There are cats that get feline leukemia that, with proper care, can live literally for years. But it's not inexpensive.
Recently, and you've said it more than once, that insurance isn't there to save you money. Insurance is there to take care of your pet. It's the same as with people insurance.
Yeah, exactly. I pay $500 a month for my insurance policy for Chris and myself. And I certainly never look at that as a way to save money. I mean, you know that with what I've been through in the last 6 months with a broken arm and now a broken finger, I've been in and out of the hospital, and I never said, boy, if I can injure myself again before this calendar year is out, I'll catch up with that monthly premium and I'll break even. That's not the way to look at it.
No, and also when I fell when I was in Colorado and dislocated my shoulder, I never for a moment worried about what it was going to cost to go to the emergency room because I have insurance. And so it just pays to have insurance on your pet.
Yeah, certainly from a peace of mind standpoint, you don't have to worry. And as we've talked about a lot of times, we talked about that we don't have the tools in veterinary medicine for cats. Well, we have, the same really nice diagnostic tools, the ultrasound and all of those diagnostic tools that we have for dogs, we use on cats as well. So, we have the ability to diagnose and manage a lot of diseases now in cats that we wouldn't have been able to 10 or 15 years ago. So, and insurance allows people to take advantage of the best and most sophisticated procedures veterinarians have available. So you don't have to make a decision about what level of care you're going to provide your cat if you have an insurance policy. I mean, you can just say, look, if you have the ability to treat this case, let's treat it. If let's treat it aggressively. You do an ultrasound, do an MRI, whatever. You can go to a specialist. It transfers between the clinic and the specialist, and you don't have to worry about saying, okay, we've got to stop treatment here because I've spent $1,500 and I just can't spend any more. You don't have to do that.
I'd like to mention also that health insurance will help with spaying and neutering. And, man, do we need to do that.
Right. There are cats. That was another part of the story on USA Today weekend. There are a lot more cats in shelters, and far fewer of them end up getting adopted than dogs. And that's kind of a sad story. And you can spay kittens very young. You can neuter kittens very young, and that's if you have a PurinaCare with preventive care policy, those preventive care procedures apply to the deductible. So, you've just got to do that stuff.
For today, I think that's a good place to stop. We'll talk to you again soon.